2, 1.
Okay. Welcome everyone convening this Monday, February 1st, 1 p.m. hearing of the Senate Health Committee. Thank you very much for all being with us. Happy to be convening. So we have a number of bills on the agenda today. I first would like to go through some notes, seeing as how this is the first remote proceeding of the Senate Health Committee. So I'd like to make some things clear. First of all, as noted in the agenda, because we have a limited amount of time in our hearing, 90 minutes, and this is the first time we're doing this, we will be instituting a 2-minute testimony limit. I've elected not to implement a timer with a buzzer going off, but I will ask that if you intend to testify before us, that you turn your video on and that you try and keep your remarks to 2 minutes. The testimony, all testimony submitted on the bills before us today has been posted on the legislative website and is available to the public. The members have seen it, and I've read every piece of testimony. So rather than reading off of a piece of paper or off of your screen, I would recommend, if you'd like to add additional remarks, please share them, or you can summarize or stand on your testimony. In the event that we have unruly or inappropriate behavior on the feed, because this is being broadcast and archived permanently on YouTube, we will ask that you keep with appropriate levels of decorum. If inappropriate behavior occurs in the committee, we will mute or remove you from the Zoom proceeding if you are disruptive. There are multiple members of staff monitoring the feed, and I will call a recess if I feel it appropriate. I'd like to start, and so going forward, I'd like to begin by introducing the members of the committee, starting with, if you folks can turn your video on, starting with my vice chair from Maui, Senator Rosalind Baker.
I had my video.
Over here. Okay, and from the Big Island, from East Hawaii, Senator Joy San Buenaventura. Good to have you. From Honolulu, Senator Sharon Moriwaki.
No.
From West Oahu, Senator Kurt Favela. There's my vice chair, Senator Baker. And I'm Jared Kehokalole, and I represent the windward side of Oahu. If for any reason the feed interrupts during this proceeding, we ask you to hold on for 15 minutes so that we can try and get things back online. And yes, the Zoom meeting and YouTube live stream event. Let me see. Oh, yeah, in the unlikely event that we need to reconvene Wednesday, February 3rd, at 1:05 p.m. and public notice will be posted on the legislature's website. We ask that members of the public who are testifying, please keep your video turned off and your microphone muted until you are queued up for testimony by a member of the staff. We do have a testimony list. You will be queued up when it's your turn to testify. And we do ask, if you run out of time, that you continue to make yourself available for questions. After each item on the agenda, I will open up the floor to questions from members of the committee to ask whatever they desire about each agenda item. And so on that note, we will begin with Senate Bill 324 relating to the practice of medicine. This clarifies the definition of the practice of medicine to provide uniformity of practice for both medical physicians and osteopathic physicians. First, we have from the Department of Commerce and Consumer Affairs, Hawaii Medical Board, Alani, is that Kigo? I'm so sorry. Okay.
No problem at all, Chair. It's Kioki.
Kioki, thank you very much.
Thank you, Chair, Vice Chair, members of the committee. I will stand on my written testimony in support of this measure, requesting amendments as reflected in paragraph 4 of my written testimony. Thank you.
Thank you very much. Next, we have from the Regulated Industries Complaints Office, Esther Brown, with comments. Okay, and from Kaiser Permanente, Jonathan Ching.
Aloha, Chair, Vice Chair, Jonathan Ching with Kaiser Permanente. We will stand on our testimony and support. In reading the testimony of the Hawaii Medical Board, we also, I guess we would say that we support their amendments for that language. Thank you.
Okay, and just to note, I am inclined to adopt the SB 1099 language cleaning up the bill. That's all the testimony that we have on file. Is there anyone else that we missed? Okay, seeing none, members, are there any questions? Okay, great. Moving on to Senate Bill 976, relating to health, which amends the definition of preceptor and volunteer-based supervised clinical training rotation to improve accessibility for providers to receive income tax credits for acting as preceptors. It also includes the Director of Health on the Preceptor Credit Assurance Committee. Department of Health, in support.
Good afternoon. We stand on our testimony in support, and would also like to express our congratulations, Chair, for your first hearing, and we look forward to a productive session with the members of your committee. We're available for questions. Thank you.
Thank you, Lauren. Next up, we have the Department of Taxation. Okay, in support.
Hi, this is Jacob Hurlitz. We're in support and available for questions. Thank you.
Okay, thank you. If it's possible, next time, please live your video so that the feed on YouTube can pick you up appropriately. Thank you. University of Hawaii.
Good afternoon, Chair, Vice Chair, committee members. The University of Hawaii stands in strong support of its in support of the measure and our written testimony, and are available for any questions. Thank you.
Thank you very much. Next, we have the Hawaii State Center for Nursing. Laura Reichart.
Hi, Chair. Laura is not in the Zoom meeting as of right now.
Okay, thank you. She is in support. Next, we have the Daniel K. Inouye College of Pharmacy, Nicholas Soy. In support. We also have testimony from the Hawaii Association of Professional Nurses, Bradley Kuhl. In support. And we also have supportive testimony from the Hawaii Primary Care Association and 8 individual members of the public who indicated that they would not be present but submitted supporting testimony. And finally, we have in support, Kelly Withy. Okay, and then late testimony from Kamlin Masuda, Jamie Abe, and Sharon Jensen. Is there anyone present on this remote meeting that we missed or who would like to submit remarks to the committee? Okay, seeing none, members, questions? Okay, moving on to the next measure, Senate Bill 599. This measure is relating to massage therapists. Beginning July 1st, 2022, requires massage therapy licensees to complete 12 hours of continuing education within the 2-year period preceding the renewal date 2 hours of which shall include first aid, cardiopulmonary resuscitation, or emergency-related courses. First up, we have the DCCA, Board of Massage Therapy.
Good afternoon, Chair, Vice Chair, members of the committee. This is Rise Doi, Executive Officer for the Board of Massage Therapy, and we'll stand on our written testimony in support. Thank you.
Thank you. And again, to members on the call, if you can live your video when it's your turn to present, it would be helpful for the members of the public who are watching so that we can all keep track of who's talking. Thank you. Next, we have the American Massage Therapy Association Hawaii chapter, Olivia Nagashima, in support. We have the American Massage Therapy Association, Lance Johnson, in support. We have Gwen DeLuz Correa, also in support. And late testimony from Fina Bonoan in opposition. Okay, that's all the testimony we received. Is there anyone else who would like to submit testimony that we missed? Seeing none, members, questions? Okay, moving on. The next measure is Senate Bill 611 relating to behavior analysts. This makes permanent the regulation of behavior analysts, exempts the behavior analyst licensing program from the auditor's sunset evaluation requirement, and is effective June 29th, 2021. First up for the DCCA, Ms. Kioki.
Good afternoon, members of the committee. I will stand on my written testimony, appreciating the intent and offering comments. Thank you.
Thank you. Next, we have the Department of Education, Ms. Armstrong.
Hi, good afternoon, Chair, Vice Chair. I'm Heidi Armstrong from the Department of Education, and we stand on our testimony in support and have offered comments.
Okay, next, we have the Hawaii State Teachers Association.
Aloha, Chair. This is Mitzi speaking for Corey Rosenlee, President of Hawaii State Teachers Association. We stand on our testimony in support, and we just want to state simply, just add that we need our behavior analysts. We need this license to be permanent. They help our students with autism, and sometimes teachers need other experts to help us. So please make this permanent. Thank you.
Thank you. Next, we have the Hawaii Association for Behavior Analysts.
Hi, Chair and Vice Chair and committee members. My name is Roxanne Bristol, and I'm the current president for the Hawaii Association for Behavior Analysis. I support Senate Bill 611 and stand on the testimony submitted. Thank you for your time.
Thank you. We have a number of testifiers. I'm going to rearrange the way we do testimony for our next hearing. But we have a number of organizations who testified in support, but indicated that they would not be present at the hearing. That's including the Hawaii Department of Health Behavioral Health Administration in support, the Hawaii Disability Rights Center in support, Together for Our Keiki in support, and we have about a dozen individual members of the public who all testified in support. Also offering late testimony, we have Amoy Hugh Penny in support.
Hello, can you see and hear me?
Yes.
Okay. Okay. My name is Dr. Amoy Hugh Penny. I'm a board certified behavior analyst with doctoral designation and licensed behavior analyst here in the state of Hawaii. And thank you for the opportunity to stand in support of the bill 611. And yes, I stand my testimony in support, and I'll be here for any comments or questions come up.
Great, thank you very much. That's all the testimony we've received. Is there anyone else on the call who we missed who would like to testify?
Good afternoon, Chair, Vice Chair, and committee members. I'm Debbie Krekel, representing HABA as well. We stand in support of our written testimony. Thank you very much.
Thank you very much, and thank you for recognizing yourself. Is there anyone else who would like to testify on this measure?
Chair.
Okay, seeing none, Senator Favela.
Yeah, hi. I just got a question. So this is to, I don't want to use the word expedite, but it would make it quicker for, I guess, not being with the auditor or something like that. Is this? Yeah.
So Senator, I'm inclined to amend the bill to remove the auditor requirement. As noted in the testimony, the auditor did perform a sunset analysis. This bill came up last year and was one of the ones that fell along the wayside after the pandemic hit. And so my recommendation to the committee is going to be to just remove the references to the sunset analysis because it was already done.
Okay, thank you for the clarification.
You're welcome. Members, any other questions? Okay, great, good question. Moving on to the next measure, which is Senate Bill 506, which authorizes the issuance of special purpose revenue bonds for long-term debt restructuring for Wahiawa General Hospital. We have testifying for Wahiawa General Hospital, Brian Cunningham.
Thank you, Mr. Chair. Madam Chair and the committee members, I'm here to stand on our written testimony in support of SB 506 relating to the support of Wahiawa General Special Purpose Revenue Bond. My written testimony is before you. I would just add, it's known by many that Wahiawa General Hospital has struggled over the last decade as referral patterns have shifted, larger hospitals have built out and hired physicians, and we've had multiple physicians retire out in our community, yet Wahiawa General continues with its dedication to serve Central Oahu and the North Shore and look for opportunities to serve the larger state. A recent example is our ability to open up a COVID-19 subacute isolation unit for the special purpose of relieving our nursing homes, our kapuna, should an outbreak occur in our nursing homes. And we've been able to relieve those nursing homes, transfer numerous residents into our isolation unit, protecting them from the devastation that an outbreak can have on them. We were thrilled to be able to serve the community in that way. Over the years, we've incurred long-term debt. We're attempting to restructure that through the special purpose revenue bond. We want everyone to know we have a bright future ahead of us. We have reconfigured our place in the continuum of care. As all of these services have shifted into the population centers on island, Wahiawa General has reconfigured our place in the continuum of care through our partnerships with Queens Health System and others. We have a bright future with the Koa Ridge project finally beginning to go into the design phase. We have a project coming up that's going to start to develop our campus. Yet these projects are 3 or 4 years into the future, and we need a bridge to get us to this bright future. And that's why we stand before you asking for support with this special purpose revenue bond. I'd stand for any questions you may have.
Thank you very much, Mr. Cunningham. That's the only piece of testimony we've received on this measure. Is there anyone else on the call that we missed?
I'd ask that you allow Rick Haig, our CFO, to answer any specific questions you might have around our finances.
Okay. Okay, thank you. Is there anyone else who would like to testify? Okay, seeing none, members, are there any questions? Okay, we're going to move to the next measure at this point, which is Senate Bill 352, relating to lead-based paint. This prohibits the use of lead-based paint on outdoor structures after December 31st, 2021. Let me see. First, we have the Department of Health. In support, Community Alliance on Prisons, Kat Brady. They are also in support. And we have 3 individual members of the public testifying in support who indicated they would not be present. Is there anyone else who wishes to testify that we missed? Okay, seeing none, members, are there any questions? Senator San Buenaventura.
Thank you. Are there any live witnesses to whom I can ask a question of?
Is the Department of Health available for questions?
Chair, I don't see our subject matter experts here, but I'm happy to take questions back and follow up with you.
Okay, so Lauren Kim, so
Yes.
I'm comparing this bill with our ban on sunscreen, oxybenzone. That one actually bans the sale of sunscreen. This bill, however, bans the use of lead paint. So I'm thinking about enforcement, right? Whereas it's easy to ban the sale by basically telling retailers you cannot sell it. But if people have lead paint in their home, how do we tell them that they cannot use it? I mean, what kind of signage or whatever do you propose we do to warn people that the lead paint that they have on their homes as of December 31 will be, if they use it a certain way, will be a criminal use?
I heard 2 points in there, Senator. One, is it worth discussing a ban more similar to sunscreen, which is up higher in the retail and distribution chain? That might make sense. There's fewer moving parts up there. And second is, how do we get education out to folks to make sure that they're aware of these bans? The legislature has in the past appropriated some funds for lead education. I think it was particularly an issue on the island of Hawai'i. And the Senate President was very interested in making sure that the department has resources. I need to check to see how much of those funds, I think it was about $100,000, whether they lapsed or how we use them, but I'll need to get back with you on our plan to educate consumers and residents on dangers in and around their home, and if this law is enacted, how they can comply. So I'll have to follow up with our plans on that.
Okay, thank you.
Okay, members, any other questions? Senator Moriwaki?
In the focus on just lead-based paint and outdoor equipment, I'm just wondering, is there some law that just is generally against and prohibits lead-based on anything? And I'm just wondering if there's a broader law or rules that you have that would cover this.
I'm fairly certain EPA has federal rules and regulations banning them. I don't know Hawaii revised statute off the top of my head, but I can find that citation. But for sure, the EPA bans the use of lead products, whether they're in gasoline or household products. And those are enforced both by our, sometimes our Food and Drug branch, our hazard evaluation and response branch, and education is performed by Children with Special Health Needs branch.
So I guess my follow-up question to that is to look at what EPA requires or what other I guess, furniture, equipment, in-house, outdoor, that we have, so that it could all be combined, and it should be prohibited across the board, shouldn't it?
Okay, I will have that conversation with my folks about a more how can we take the opportunity for a more comprehensive ban on anything with lead. I just want to make sure that that keeps with the title of the bill. But I'll work with, well, the bill says lead-based paint, so I think we're restricted to that. But it's still a worthwhile public policy discussion, and we'll put that on our to-do list and get back with you. Perhaps we can amend the vehicle.
Thank you, Chair.
You're welcome. Also to note to the members that Chapter 41 of the HRS contains a pretty comprehensive section on lead-based paint, including directives to the department for the establishment of their environmental hazard program and administrative rules. Any other questions, members?
I have a follow-up question then. So why are we specifically signaling out just lead-based paint and outdoor furniture if there is such a comprehensive law?
I think the most recent investigations reveal that the household, houses, interior walls that were painted many years ago when they're renovated or they're building an Ohana unit or something like that, that appears to be the most prevalent source of environmental lead poisoning. I'll need to kind of, again, follow up on why this isn't our bill, so I'm not really sure why we're zeroing in on paint that may already be on the walls that's already illegal, but certainly as a means to Senator San Buenaventura's point, to educate people, to call attention to the fact that you still can't be using it if you have this stuff lying around in your shed for 15 years. So it was home related and environmental related lead exposure that drove the most recent cases. And so taking one step back in the investigation, somebody might have thought it was a good idea to remind people and to exercise more enforcement on lead-based paint that you may just have lying around. That's my speculation, but it's probably pretty reasonable.
So, may I have a follow-up?
San Buenaventura.
Thank you. So, Lauren Kim, since you're the only live witness, I'm sorry about this, but
no problem. Good job.
Couldn't we amend this bill to add in monies for education? Because I mean that's the problem is if people don't know whether or not what they're doing is wrong or illegal, seems to me it's unfair to go make them a criminal. Whereas we either just totally ban the product itself, like sunscreen, or put some monies in for education to let people know what they're doing is wrong and illegal. Thank you.
My response is if the chair is so inclined to maybe hold off on the committee report, give me maybe 24, 48 hours. Let me see what existing funds we may or may not have. In a tight budget year, I wouldn't want the presence of an appropriation to derail a good policy bill. And it may be that we have to either find the resources internally or come back when things are a little better to do some education. But for what it's worth, it's probably worth putting on the books this ban. But I think collectively, the legislature will need to weigh the risk of putting an appropriation in. But please let me figure out what resources we may have to do this education, both from our environmental response side and from the Children with Special Health Needs branch side. So I'll follow up with the chair, hopefully within 24 hours.
Okay, members, any other questions? Okay, thank you, Lauren. We are going to move to the next item on the agenda, which is Senate Bill 266, relating to the coronavirus 2019 pandemic, which is an appropriation vehicle that we are electing to move now in anticipation of additional monies coming in for operations to address the pandemic. Department of Health.
The department will stand on its testimony in support, but without providing specific numbers, which would be premature at this time. Thank you.
Okay, thank you. And Department of Human Services.
Good afternoon, Chair, Vice Chair, and committee members. I'm Joseph Campos, Deputy Director of Department of Human Services. We stand on our testimony in support, and I'm available for questions should you have any. Thank you.
Thank you. And just to note for the members and testifiers, thank you very much for your testimony, DHS. My intention is to amend this bill to insert the descriptions in Senate Bill 1088, which is the administration vehicle that's intended to facilitate the same appropriation, so that there are more clarity to the different operational descriptions of funding, and then blank out the amount so that further discussion can be made in WHAM. That's all the testimony we've received. Is there anyone else on the call who would like to testify? Okay, seeing none, members, are there any questions? Okay, seeing none, we are going to move to the last measure on the agenda, which is SB 262 relating to vaccines, which is essentially the same thing. It is a funding vehicle in anticipation of additional monies to execute our state vaccine plan. Department of Health.
The department will stand on its testimony in support. Thank you for introducing this bill, Chair.
Okay, great. Are there any other testifiers that I missed? Okay, seeing none. Members, any questions? Okay, seeing none, we are going to recess for decision making. Recess.
Two, one.
Okay, moving back into reconvening the Monday, February 1st, 1 p.m. agenda of the Senate Health Committee for decision making to vote out a number of these Senate bills. First up, we have Senate Bill 324, which amends the definition of the practice of medicine as it relates to osteopathic physicians. I'm going to recommend that we adopt the language from Senate Bill 1099, which cleans up the redundant references to licensure, and move this bill out as an SD1. Members, any questions or comments? Okay, seeing none, Vice Chair, can you please take the vote? Chair votes aye.
Chair votes aye. Vice Chair votes aye. Senator Moriwaki.
Aye.
Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Measures adopted.
Thank you very much. Thank you, Vice Chair. For the members for members of the public or on staff who are on Zoom, I think we have someone in the background who's hot. Okay, so we're going to move on to Senate Bill 976, which amends the preceptor tax credit to make it a little bit easier to apply to preceptors. We are going to add language to the bill clarifying that the bill applies to all of the year 2021 and the effective date. So we'll be moving this as a Senate Draft 1. Members, any questions or comments? Okay, seeing none, Vice Chair, can you please take the vote? Chair votes aye.
Chair votes aye. Vice Chair votes aye. Senator Moriwaki.
Aye.
Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Measures adopted, Chair.
Thank you. Moving to Senate Bill 599. This is related to massage therapy. After conferring with the members, I'm going to adopt the recommendation of the Board of Massage Therapy and move the implementation date of the requirements to July 1st, 2024. We're also going to defect. Oh, I'm sorry. Yeah, that's it. So the effective date will be upon approval and the implementation date will be July 1st, 2024. So we'll be moving this as a Senate Draft 1. Members, any questions or comments? Okay, seeing none, Chair votes aye.
Chair votes aye. Vice Chair votes aye. Of the other three members on the call, anybody with reservations or voting no? If not, I votes all around. Measures adopted, Chair.
Thank you very much. Next
Chair,
measure,
before-
Senate Bill.
Before we move on, the way I just did that vote, is that appropriate or do you want me to call everybody?
I think that's good.
So I think for the members of the public watching, we've taken a number of roll call votes. We have a number of measures left. And since all members are present, then I think that's acceptable.
Okay.
Members, any comments or concerns about that? Okay, great. Moving on to thank you for the question. Moving on to Senate Bill 611. This removes the sunset on the behavior analyst licensure. The recommendation is going to be to delete Section 3, which notes the requirement that the auditor do a report. Since the auditor has already completed an analysis on the licensure regime, we're just going to remove that section and move the bill on to the next committee as a Senate Draft 1. Members, any questions or concerns? Okay, seeing none, Chair votes aye.
Vice Chair votes aye. Of the other three members on the call, any reservations or no votes? If not, I'll cast an aye vote for all members of the committee. Measures adopted.
Okay, it actually looks like I'm getting a note here that roll call might be required. So what we're going to do is take a recess real quick and make sure that we get this right so that we don't have to push these important measures off to another hearing. Recess.
Two, one.
Okay, reconvening our decision making on the Monday, February 1 p.m. agenda. I'd like to thank everyone for their patience. In the abundance of caution, we are going to retake roll call votes of the previous two measures just to make sure that the bills pass in the proper way. So again, taking up SB 599, which relates to massage therapy. The recommendation is to delay implementation of this measure until July 1st, 2024. Chair votes aye.
Recommendation of the chair is to pass 599 with amendments. Chair votes aye. Vice Chair votes aye. Senator Moriwaki.
Senator Moriwaki, you are on mute.
Aye.
Thank you. Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Thank you. 5 ayes, measures adopted. The next measure is Senate Bill 611. Chair, do you want to?
Senate Bill.
I keep rolling.
Yes. The recommendation is to delete section 3 referencing the auditor's report. So we're moving this as a Senate Draft 1. Chair votes aye.
Chair votes aye. Vice Chair votes aye. Senator Moriwaki.
Aye.
Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
5 ayes, measures adopted, Chair.
Thank you very much. Senate Bill 506, which is the special purpose revenue bond for Wahiawa General Hospital. We're going to defect the date and add language in the committee report related to the purpose section of the bill so that there's some clarity moving forward. Any questions or comments? Seeing none, Senate Draft 1, Chair votes aye.
Senate Bill 506, passed with amendments. Chair votes aye. Vice Chair votes aye. Senator Moriwaki.
Aye.
Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Chair, your recommendations adopted. 5 ayes.
Thank you very much. Next measure is Senate Bill 352 related to lead paint. The recommendation is to defect the effective date. And once it's available, we will add in an update from the Department of Health in the committee report as to whether there are funds available to do additional education on lead-based paint. So the recommendation is to move this out as a Senate Draft 1. Any questions or comments? Okay, seeing none, Chair votes aye.
Recommendation is to pass Senate Bill 352 with amendments. Chair voted aye. Vice Chair votes aye. Senator Moriwaki.
Aye.
Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
5 ayes, measures adopted, Chair.
Thank you very much. Next measure is Senate Bill 266, which is an appropriation vehicle for coronavirus pandemic operations. The recommendation is that we're going to insert the descriptions that are in Senate Bill 1088, which is the administration vehicle. So we'll be inserting the descriptions of the appropriations into Senate Bill 266. We will blank out those appropriation amounts and defect the effective date. Members, any questions or comments? Okay, seeing none, Senate Draft 1, Chair votes aye.
Chair votes aye. Senate Bill 266 with amendments. Vice Chair votes aye. Senator Moriwaki.
Aye.
Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Chair, your recommendation's been adopted.
Thank you very much. And the last measure on the agenda is Senate Bill 262 relating to vaccines. This is another appropriation vehicle for the state vaccine plan. Seeing as how the appropriation amounts in the bill are already blank, the recommendation is to defect the effective date and move this out as a Senate Draft 1. Members, are there any questions or comments? Okay, seeing none, chair votes aye.
Chair votes aye on Senate Bill 262 to pass with amendments. Vice Chair votes aye. Senator Moriwaki.
Aye.
Senator San Buenaventura.
Aye.
Senator Favela.
Aye.
Thank you. Chair, your recommendation's been adopted, 5 ayes.
Thank you very much. Thank you all for your patience, and we are adjourned.